ಹಾಯ್ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ ಸಂದೀಪ್. ವೆಲ್ಕಮ್ ಟು ಸ್ಯಾನ್ಶೈನ್ ನರ್ಸಿಂಗ್ ಸ್ಕಿಲ್ ಸ್ಟುಡಿಯೋಸ್. Today I am here to talk about nursing process. Why this nursing process? What are the objectives of nursing process? What are the steps that is involved in this nursing process? How important it is for the nurses to learn about this nursing process, especially the nursing diagnosis. How are we going to write the nursing diagnosis? So these are the few things that we are going to discuss today. ಇವತ್ತಿನ ವಿಷಯ ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಾವು ಇವತ್ತು ಕಲಿಯಕ್ಕೆ ಹೋಗ್ತಾ ಇದ್ದೀವಿ. ಈ ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ಸಿಂದ ನಮಗೆ ಏನು ಲಾಭ ಇದೆ, ಅದನ್ನು ನಾವು ಯಾಕೆ ಕಲಿಬೇಕು, ಆ ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ ಒಳಗಡೆ ಎಷ್ಟು ಸ್ಟೆಪ್ಸ್ ಇದ್ದಾವೆ, ಆ ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ದ ಡೆಫಿನೇಷನ್ ಏನು, ಆಬ್ಜೆಕ್ಟಿವ್ಸ್ ಏನು, ನರ್ಸಿಂಗ್ ಡಯಾಗ್ನೋಸಿಸ್ನ ನಾವು ಯಾವ ರೀತಿ ಫ್ರೇಮ್ ಮಾಡಿ ಬರೀಬೇಕು, ಯಾವ ಥರ ನರ್ಸಿಂಗ್ ಡಯಾಗ್ನೋಸಿಸ್ ನಾವು ಮಾಡಬೇಕು, ನರ್ಸಿಂಗ್ ಡಯಾಗ್ನೋಸಿಸ್ಗೂ ಮೆಡಿಕಲ್ ಡಯಾಗ್ನೋಸಿಸ್ಗೂ ಯಾವ ಥರ ಡಿಫ್ರೆನ್ಸ್ ಇದೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ನಾವು ತಿಳ್ಕೊಳ್ಳೋಣ. ಈ ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ನ ಕಂಪ್ಲೀಟಾಗಿ ನಾವು ಕಲ್ತ್ಕೊಂಡ್ರೆ ವಿ ಕ್ಯಾನ್ ಬಿ ಎ ಬೆಟರ್ ನರ್ಸಸ್ ಅಂತ ನನ್ನ ಅಭಿಪ್ರಾಯ. ಸೊ ಬನ್ನಿ ಹಾಗಿದ್ರೆ ನೋಡೋಣ. Nursing process is a skill. Yes, every nurse has to apply these skills in her day-to-day life because when she goes to treat a patient, she has to achieve her goal in sending out a patient from the hospital in a better health. The objectives of nursing process is as follows. The purpose of nursing process are as follows. Now let us understand the meaning and some definitions and components of nursing process. Nursing process basically depends on 5 components such as assessment, diagnosis, planning, implementation and evaluation. And how are we going to compare nursing process with the scientific method? And this is how we are going to compare it. The characteristics of nursing process includes systematic, dynamic, interpersonal, outcome oriented, and it should be universally applicable. So to begin with, let us start with the assessment, which is the first step under the nursing process. Assessment is very important because through which we are going to collect some of the information about the patient's health conditions. It is a first step to determine the health status of a patient, and we are going to do it by gathering some of the information. What is the definition? It is a systematic and continuous collection, organization, validation and documentation of a data from the patient. Assessment has several types, under which first one is initial assessment, second problem focused, third emergency assessment, and fourth time lapse assessment. And the purpose is as follows. In order to perform assessment in the patient, we need to have the following skills like observation, interview, physical examination and insight. So these are the few skills that we need to apply while carrying out this assessment method. Assessment activities like collecting the data, validating the data, organizing the data and documenting the data is very important. Data collection, it starts with the subjective data and the objective data. So how to get this information? This information can be gathered by 2 sources. One is primary source from the patient, secondary by the family, health professional, health record, laboratory diagnostic analysis. So once the assessment is done, once we gather complete information about the patient, we move on to the second step called diagnosis. What is this diagnosis about? Nursing diagnosis is a clinical judgment about the individual, family or community response. So how are we going to get benefit out of it? The nursing diagnosis gives us a benefits by creating a standard for nursing practice, provide a quality improvement base, and it promotes the identification of appropriate goals. How to achieve these goals? By making a diagnosis under NANDA, that is North American Nursing Diagnosis Association. This follows the 3 steps, that is, it is based on problem, etiology and signs and symptoms. How different is nursing diagnosis from medical diagnosis? Here are some examples. Here are some of the examples of Nanda nursing diagnosis which will be helpful for you while writing nursing care plans. After gathering the information from the patient by a nurse through a method called assessment, she was able to diagnose a patient based on his problem. The next step is planning. What is this planning? How the planning help a nurse to manage the problem? The planning consists of 3 stages: initial planning, ongoing planning, and discharge planning. This planning is nothing but, as we already know, that we need to plan starting from the basic needs. When we are planning, we should think about the basic needs of the patient first. We need to prioritize, that is, which is important, which is least important, which is very much important. So based on that, we need to plan for the treatment for the patient. So based on this hierarchy, it says the basic needs, psychological needs, and self-fulfillment needs. So based on this criteria, we need to plan for the patient. The next step under nursing process is intervention. Here the nurse completely focuses on treating the patient. She may take the decision independently, she may take the decision depending on the doctor's advice or with a collaborative team. The next step under nursing process is implementation. So implementation is nothing but putting our plans into action. That is, we are going to bring all the thoughts which we have planned in the nursing intervention into actions. Documenting the nursing activities is also very much important. There are some skills which is required for implementation, that is, cognitive skills, interpersonal skills, and technical skills. Evaluation is the last phase of nursing process. It is very vital because it will help us to judge our nursing care to the patient. The decision to continue, modify, or repeat the process is completely dependent on evaluation. While documenting evaluation phase, nurse can draw 3 of the possible conclusions. Goal was met, the goal was partially met, the goal was not met. Hopefully the information shared here was informative. Kindly leave your comment below.